Most patients associate erectile dysfunction with the inability to have or maintain an erection. Erectile dysfunction can also be simply not being satisfied with the way your erections are or with the way you experience intercourse. Therefore, a discussion with a qualified professional is very, very important in order to make sure that you receive the care that you're looking for. Erectile dysfunction is a very common problem. Over 30 million men in the US suffer from this condition, and the numbers are likely a lot higher, but most men do not report this issue to their physicians. There are different causes of erectile dysfunction. One of the most common problems is vascular damage or cardiovascular disease in general. As cardiovascular disease develops, patients start developing plaques in their arteries, which constrict and slow down blood flow, and therefore they're having more difficulty having or maintaining erections. Other common causes are things like nerve damage that can be caused by diseases such as diabetes. These conditions are very common in the US, and therefore erectile dysfunction is also very common. Erectile dysfunction is diagnosed by taking a history from the patient and also doing a thorough physical exam and sometimes additional testing as necessary. It is very important that you disclose any of your concerns with your physician so that they can appropriately guide you down the pathway. As erectile dysfunction is often caused by other diseases, such as cardiovascular disease or diabetes, we try to optimize those things for patients and therefore reduce the risk of erectile dysfunction. The benefit of seeing a specialist or a urologist who specializes in erectile dysfunction and men's health is that you can receive all of the care in one place. There are 4 common treatment options available for erectile dysfunction. One of them is medication. The majority of patients are familiar with them, things like Viagra, Cialis, or Levitra. Other treatments consist of vacuum erection devices, injection therapies, and penile prosthesis surgery, which has the highest patient and partner satisfaction rate. In order to determine which treatment is best for you, you should see a specialist who can guide you through the treatment pathways. We can always find a treatment that works best for you. The satisfaction rate for each treatment depends on the individual patient. However, we see a trend where patients who do respond to medication tend to be very satisfied. Patients who use things like vacuum erection devices or injections tend not to be as happy, and patients who move on to a penile prosthesis have satisfaction rates of greater than 95 to 96%. Like with anything else, if you don't use it, you lose it. Therefore, not being able to have erections leads to a decrease in size and may cause atrophy of the tissue, which can be permanent.